I'm Dr. Allan Perel. This is Conversations in Medicine. This program focuses on cutting-edge issues in medicine with a focus on the Staten Island community. Today's program will focus on sports-related injuries. Whether you're a weekend warrior or a professional athlete, injuries occur. As a neurologist, I see many people with head injuries, neck and back injuries, and other nerve injuries. My guests take care of people with a variety of sports-related injuries and really do a wonderful job with them. My son Evan, who plays high school basketball, last year fractured his ankle, and one of my guests took wonderful care of him, and he's back on the team this year. My guest, I'd like to introduce Dr. John Linsalata, who's a wonderful orthopedic surgeon whose practice is on Staten Island, and Joe Saracino, physical therapist, who's co-owner of One-on-One Physical Therapy and Sports Rehabilitative Therapy. Welcome.
Thank you.
Joe, let's jump right in. I know you do a lot of work with a lot of sports teams. When someone gets hurt in a sporting event, how do you assess them and what do you do?
Well, usually the medical staff on the field does an on-the-field assessment, which could vary from some special tests to just subjective questions that they can answer, that the athlete can answer on the field of where it hurts, what was the mechanism of the injury, what exactly happened. And a lot of times, you know, if the trainer's paying attention or the therapist is paying attention on the sidelines, they kind of see what happened and the mechanism of the injury, and they have kind of an idea, and they know what questions they're going to follow up with. And then some special tests are usually performed once they get the player off the field onto the sidelines. And that's when you basically assess whether, okay, is this just something minor, they just, you know, got hit a little bit, or, you know, or is it something that's more serious? If it's something more serious, then obviously the player's withheld from playing in that game, and there's further assessment that goes on afterwards.
Wonderful. And John, maybe just for some definitions for everyone out there, we hear the word sprain, strain, fracture, hairline fracture, and I know it would take an entire lecture to go over each one of them, but just give me a ballpark figure of what kind of things are these,
Sure.
What are they describing?
Well, a sprain by definition is an injury to a ligament. So a stretch injury to a ligament, and we grade them based upon the severity of the injury. So a grade 1 sprain would be a milder sprain, grade 2 and grade 3 is often a complete tear of a ligament. Strain we'll use more for injuries to muscles and tendons. So that's a distinction. So a similar strain injury, like a hamstring would be a strain injury, whereas a medial collateral ligament in your knee would be a sprain by definition. Fracture is the medical term for a break. We'll often get patients who they'll say, oh no, I didn't fracture my wrist, I broke my wrist. There's no difference. The medical term is fracture, the colloquial term is a break, and that's a crack in the bone. And it can be non-displaced or a hairline, or it can be a displaced fracture. And that distinction is, determine the type of treatment the patient needs.
Interesting. So when someone's injured, recreational athlete, running, how do they know when to seek medical attention?
Well, I guess if you have an injury that, we all have pains. You go out, you have a little, you run around, especially as we get a little older, you get more pains. Yeah, you go out and play a little bit, you come back, your knee hurts. If it hurts for a couple of days and it's nothing unusual, you don't have a lot of swelling, and the pain is improving, that's something you can probably wait on. When you start getting pain that's intense, or you see a lot of swelling around the area of injury, if it's not improving to the extent that you expect it to, that's a reason to have an evaluation. In children, I think you have to be a little bit more cautious. If they swell at all, I'm always more concerned. Children don't tend to swell in their injuries as much as adults do. So if you see a child falls and their wrist hurts, or their elbow hurts, I think it's more reason to be assessed, because their bones are actually weaker than their ligaments. So when you see a child who has a sprained ankle, you have to also be thinking maybe he has a crack in the growth plate or a sprained wrist, as opposed to an adult. So you have to really know the person you're dealing with and the age of the patient.
Now I'm going to ask a real tough question. In your opinion, which sport do you think is the most dangerous?
Well, I mean, I guess for traumatic injuries, you always, look at football, the speeds that they're going at, and it's not really a contact sport, it's more of a collision sport. So we see more traumatic injuries in a sport like football. However, you'd be surprised with the non-contact sports, like let's say baseball. We see a large amount of repetitive stress injuries when it comes to a sport like baseball. you know, you see so many pitchers now with who need Tommy John surgery, UCL tears in their elbows and rotator cuff tears in their shoulder. You know, nobody's tackling them on the pitcher's mound, so why are they getting injured? And from a physical therapist standpoint, what we look at is muscle imbalances, joint imbalances, movement imbalances, asymmetries in muscle that cause the athlete to perform that activity in a way that's detrimental. And eventually that wears and tears, and that repetitive stress eventually causes the injury. So as far as the most dangerous sport, you know, I guess the likelihood of getting a serious injury is greater in a contact sport like football, but you know, you can go out for a jog and get injured. You know, injuries are happening. You know, sometimes you just can't avoid them.
In a sport like football, you have 22 players on the field at one time who are throwing their bodies at each other. Whereas in a sport like baseball, there's one person on each team who's really active in any instant, you know, or at least around the ball. So you're going to see injuries, but perhaps not as frequently.
What about the difference between boys and girls?
That's a good question. Big
Yeah,
difference.
I mean, you know, the young female athlete nowadays is really at risk. The female adolescent athlete seems to be at high risk for injuries, especially the most common one being ACL injuries. And you know, there's a lot of reasons and different theories as to why these injuries are happening to these young adolescent females. But the truth of the matter is they're just moving faster than they ever have in these sports. And they're playing more often. And you know, when it comes to these female athletes, they're going at such a high speed, but the truth of the matter is some of them, it just comes down to a strength issue on whether they can slow themselves down. And a lot of the injuries that are happening to the female athletes, these ACL injuries, are occurring what we call during deceleration. So when they jump, there's no injury. But when they land, there is. When they run, there might not be an injury. But if they want to stop and change direction, there is. So the stopping and changing direction falls under the category of what we call deceleration. And when you don't have great core stability and good glute strength and good proper mobility and good movement mechanics, slowing the body down is a challenge. Especially, we also see a lot of times if these girls don't have good endurance and they start to fatigue, at the end of the games, they're even at more risk. So I think it's a combination of the speed that they're playing the game at and also the fact that it puts a lot more stress on the body playing it at that speed and whether or not they have the strength to control their bodies the right way.
The incidence of ACL tears in females is probably between 2 and 10 times the incidence of males. And that really kicks in around adolescence. So the younger girls, when you see an 8-year-old and a 10-year-old, they're equivalent. It's when you start hitting high school that you start seeing these differences. And you know, and predominantly the non-contact type of injuries. So we kind of look at ACLs as a contact injury, where they're you know, as a tackle, for example. And that's probably going to be equal in either.
Right.
But the majority of the ACL injuries we're seeing are non-contact, and those are the ones that are particularly higher incidence in females. And there's again a lot of reasons behind it. You know, whether it be anatomic, where females their femurs are smaller, so their ACLs are ultimately smaller. So the ACL, the ligament itself, is not as strong. But I think probably a lot of it comes down to neuromuscular issues as far as the way they land, the way they're able to control their body, the way females tend to absorb less of the energy. When you land on the ground, that non-contact, that force, the joint reactive force from the floor is being transmitted into their leg. Females are less able to absorb that energy into their muscles, and a lot of it gets more transmitted actually into the ligament. So there are more incidents of injuries that way. We see more quad dominance in females, where they tend to fire their quadriceps more rather than their hamstrings. Their knees are a little bit more extended. They're more likely to get injuries. Less core control, so they tend to sway their upper body more, and you'll create more valgus, which is their knees coming together, which is you know, a high risk for developing ACL injuries. So those are things that we see, and along the same lines, those are things that you can sometimes work on to try and prevent injury.
How interesting. I know your daughter very well as a soccer player, and we all have kids in that high school, teenage era. Are there any sports that you would recommend a parent that they should, we talked about what might be the most dangerous, but what should they go into? say they're not on a level to be in a Division I college, they just want to do well. Is there one versus another, like girls with soccer, boys with baseball, that you feel, I mean, I know you have to do what you like, of course,
Right.
but is there any one or the other that you're more concerned about, less concerned about with injuries?
Well, I think the art that's been lost is playing multiple sports. You know, it's when I was a kid, I played baseball and basketball. When baseball was going on, I didn't even see my basketball. And when basketball season was going on, my baseball glove collected dust. And now it just seems that, unfortunately, and I don't know if it's because dreams of becoming a professional or dreams of collegiate scholarships, but kids tend to gravitate towards one specific sport, and unfortunately I find them giving up on other sports. And sometimes there's some theories that believe that leads to some injuries because they're doing the same thing over and over and over again, and they're not really challenging their bodies to do something else. So, for example, you talk about the baseball player, like I was saying before, if they're not taking a break from throwing, and you're throwing 12 months out of the year, something's going to give eventually. And the mileage that they're putting on their bodies doing the same exact thing could be detrimental. So to answer your question as far as what sport would I recommend, I would recommend you play many and the ones you like the most.
Yeah, particularly when they're younger. I think sports are a great outlet for children, socially, physically, mentally. It gives them something to do outside of school. I think they should be involved in multiple sports if possible. Kids will tend to gravitate to what they enjoy. Ideally, they should be playing different sports different times of the year. I think, unfortunately, we're seeing more and more, as Joe alluded to, these subspecialization at such an early age, and it's definitely not good for children's development. And I think there's a much higher incidence of these repetitive, stress injuries in children who are kind of focusing on one sport. So it's hard to tell what sport you should play, but it's probably best to play multiple sports.
And clearly the repetitive portion of that. So now Joe and I have something in common. We see a lot of people who have had head trauma, and I know you guys have trainers out in a lot of the schools, as we were talking about before. I see the kids when they come to my office after having significant head trauma, and the one thing, if there's anything I could ever say, is that you don't have to lose consciousness to have a concussion.
Right.
And if you have a concussion, by definition, your pictures of your brain, like an MRI or a CAT scan, are normal.
Right.
So what happens on the field when someone gets hit in the head and looks woozy, or what do you guys do? Because when they come to me, it's a much more calmer situation. Usually there's a parent with them. We're able to talk about what happened and really dive into it. On the field of play, what do? Do you have to take everybody out of the game? And maybe give us a little idea what happens. And really to make both the parents, the coaches, and everyone feel comfortable that we're on top of this.
Right. Well, you know what? It is a big challenge because, like you said, diagnostic testing doesn't really tell us a lot on the concussion patient. So you are definitely relying a lot on your subjective reports. And what we do is, we're the trainers for most of the high schools on Staten Island, and what we do pre-season is we prepare the kids for this. And we try to tell them, listen, make them understand the severity of what could happen to them if they try to play through a concussion. The long-term effects, if you're not playing, this is not your career. You have a whole life ahead of you after this. Don't put yourself at risk to get back in the game. It's not that important. You're talking about your life here. So a lot of times when we prepare the athletes that way pre-season, when we have to have that conversation on the field, the kid recognizes and remembers that conversation. And when you ask them the questions, they're honest with you. How do you feel? Is your head ringing? Do you have a headache? Do you have sensitivity to the light right now? Did you get your quote-unquote bell rung? And a lot of times, because of the preparation that we do for them pre-season, they're honest with us. But after that, it becomes a whole different protocol for us as far as treating the concussion patient.
Yeah, I think that the short answer, if you have a concussion, you should not go into the game, period. I think that's the policy now
Yeah.
across the board.
Yeah, we
so if you have a
definitely
child,
err on the side of caution.
who comes out and you make an assessment and your belief is that they had a concussion, they absolutely should not return to play that day. That's I think the current guidelines. Whereas 10 years ago that was not the case.
Right.
You got your bells rung, you come out, you feel okay, you go back in the game. So I think we're making progress in understanding the potential severity of concussions, and particularly that second impact type syndrome. If children get that, it can be devastating. And adults too, but I think children are probably a little bit more sensitive to it. They're more potential to have those more easily. And that too is something we see more common in females for the same sport. And probably for the same reason. Their muscles don't absorb as much of that energy, so they get more of that energy transmitted into their brain. So you'll see more concussions occurring more easily, and probably more significant symptoms in females.
As you know, even with soccer, the idea of whether they should be allowed to head the ball or not is always an issue. And no matter how good the helmets in football are, they'll never be enough to protect against these rapid interactions, these forces. Interestingly enough, as a neurologist, the key thing that I tell the kids, and I see 2 or 3 kids per week coming into my office, and they come with their mom and everyone's concerned. The first and foremost is that they don't go back to doing anything strenuous, both physically and mentally, until they're 24 to 48 hours fully symptom-free. Not that they have a little headache, not that they're a little bit dizzy, not that their balance is off, not that they don't remember things, but really to the point where they're back to themselves.
Right.
And then it's 24 to 48 hours later. And the coaches have been marvelous about it. I have to say the coaches on Staten Island have been great about it. I've had no complaints, no matter, even if it was the day before the championship game. Right. And that's something I think that's been a real testament to what we've learned over the years.
Yeah, it's definitely taken some years to get that education across, but I think everybody seems to be on board now.
And tragically, I've seen some professional football players
Right.
who've developed that CTE, chronic traumatic encephalomalacia, or just holes in the brain because of the chronic repetitive injuries. Some very famous guys that we've seen. And it can lead to depression, suicide, dementia. So there's a lot of things that are really heavily involved with that. So head trauma is such an important thing. What I think is a little bit under-recognized is what happens at the time of the trauma. Did the kid have it or not? If a kid stands up and takes 2 or 3 steps that's a little bit off balance, basically that's it.
That's it.
It doesn't take more than that.
No.
It doesn't take the headache, it doesn't take the dizziness, it doesn't take the complaints. It takes just the kid's not right. And just for a few seconds to have them be able to go off the field.
Yeah, it's easy after the fact, or easier, to say, yeah, you had a concussion. The time that it can be more challenging is right there on the field to take the child out.
Yeah,
and
well,
I
you've
think
heard,
you need to have the ability to feel confident that that's the right thing to do.
I mean, you hear about the professional athletes lying their way back onto the field.
And you'll see the same thing in kids.
So,
I've been there. I mean, as a physician on the field, but also as a coach. And you ask the kids, and they'll go, "No, I'm fine. I just hit my head." And you have to be, And there are just little, like the SCAT is that for on field assessment that it's good for coaches to have, and they can pull it out and tells you what questions to ask and what sort of things you can look for to help make that concussion assessment more easily. Because the thing is, a lot of sports, football, you have to have a trainer or a physician on the sideline. Whereas most other sports you don't. So a lot of it falls on unfortunately into the realm of the coach to make that decision. So I think there's been a big push to get the coaches educated, and I think that's been helpful. And
coaches and the parents. And as we said before, multiple head traumas are additive.
Right.
So sometimes somebody's had concussion a year ago, they come with this trivial thing that would look like nothing, and that leaves them with a lot of deficit for weeks to months, and that's something that's very difficult. So what do we do to try to prevent injuries?
Well, like I said before, some injuries you just can't avoid. However, when we talked a little bit before about non-contact injuries, and we believe there is definitely ways to prevent some of these injuries. The proper off-season training is important. Rest is important. Like I was saying before, some of these athletes who are just playing 12 months throughout the year, no rest at all, they don't give their bodies any time to recover. And if they're doing a specific activity, they're certainly not giving their bodies any time to recover. So a combination of rest and then the proper off-season training. we've done some off-season training for some pretty high-level athletes, and some of the things that we do is we'll do an assessment before we do anything, and we'll check mobility, range of motion, strength. There are a couple of really good screening methods that are used by therapists and trainers, functional movement screen, that kind of just brings a red flag to certain movement patterns that aren't being done correctly. And when we find that, we look a little bit deeper as to say, okay, why isn't it being done correctly? What's the missing piece here? Where's the mobility loss? Where's the flexibility loss? Where's the strength loss? And then we'll try to cater a strength and conditioning program for that specific athlete. Now that's taking it to an extreme. However, there are some off-season programs that, kind of catch most issues. A combination of doing exercises that improve core stability, exercises that improve mobility in key areas. We're big believers that hip mobility and mobility in the thoracic spine is very, very important because it allows your core muscles to really engage and be used functionally. We're big believers in glute strength, because the biggest muscles in your body will produce the most energy and will absorb a lot of your energy. And a lot of people who have glute weakness tend to get knee injuries, back injuries. Those are the injuries that most commonly occur non-traumatically. So a combination of rest and then a good off-season training program is important. The problem is, like I was saying before, some of these athletes just don't have an off-season, and they're just not taking the time to take those proper steps.
And getting back to what we said earlier, I think when you're isolating one sport and you're playing 12 months a year, and then some kids are playing on 2 or 3 teams, that is a potential setup for an overuse injury of a particular sport. I think that the other thing we see in kids, I think as they grow, the core strength is probably the last thing they get. And when you get the kids who go to the gym, they all hit the bench and they're at the bench press and they're working on their chest and their upper body, and really they forget core. I think that's probably one of the last things to see come back or develop in kids as they're growing, and that puts them at a high risk of injury. And I think it's not until later that they start realizing the importance of core strength.
Yeah.
And I think a lot of the stability for our lower extremities comes from your core, even your upper extremities.
Yeah.
Most of the power for a baseball player, their pitch, this comes from their core. So it's very important to build up your core strength. I think there's been an emphasis on reducing the volume of pitches. So now Little League sets guidelines, how many pitches you can throw at a certain age. The problem is that that's great for the team. That team will say, okay, he's thrown his 60 pitches, he's done for the game, or his 75, he's done for the week. The problem is that Joey's also playing on a second team, and he plays in the schoolyard at lunch every day, so you don't realize the volume that they're actually throwing. Limiting the types of throws in baseball players and in children. There's been some guidelines not allowing to start throwing curveballs until they're in high school. It puts different stresses across the elbow and increases their incidence of developing elbow problems. So I think there are certain guidelines that are out there that the coaches need to know about, and I think they do know about for particular sports.
Interesting, because it's funny, looking at what I do, I see a lot of people with neck and back injuries, carpal tunnel, nerve injuries. So now we're going to get to the recreational athlete.
Right.
The guy, the weekend warrior, the guy who's going to go out there, they worked all week, it's now Saturday morning, or Tuesday night at 11 o'clock at the JCC or the YMCA, and they're going to go full out in their basketball game. Now, give us a little bit of an idea. What should they do? I mean, these are the guys who used to be great athletes, getting a little bit older. Maybe we're not as sharp as we were before. Gained a few pounds, as I know. And what do they do? I mean, is it sneakers? Is it just knowing what to do? Is it working out, stretching? Because I want to spend our last few minutes on things that people could do every day. Right now we've talked about athletes, and there are a lot of moms and dads and coaches might be listening to us. But in the last few minutes we're going to talk about, what about you? What kind of stretching should you do? What kind of sneakers should you wear? What kind of should you be playing basketball if you're 50 years old in a competitive league?
Right.
So what are your thoughts about that?
Well, warming up, I think, obviously is important. Stretching before, warming up before. and staying fit before you kind of jump into any sport. But I think we see athletes playing, I've guys who are 70 years old who still go down to spring training every year in Florida and play baseball. There's no reason you can't stay active as you get older. I think you just have to realize your limitations and keep yourself fit and prepare. So you're not just jumping in at a high level immediately and you're working into it.
But I'm going to jump in. How do you know your limitations? In a sense, other than your spouse telling you that you're crazy, or your kids looking at you and saying when you go into the basketball court at the JCC, "What are you doing here? You're going to embarrass me."
Well, we always I tell patients, listen to your body. If your body is in just pain for days after that one basketball game that you played, and you're getting swelling and things like that, that's your body telling you something that maybe this isn't what you should be doing. As far as, the plan doesn't really change. I still think that there should be some off-season, but basically it's not really an off-season training for the adults. They have to be doing some corrective exercise to maintain mobility, maintain strength as they get older. I'm a big advocate of yoga and exercises like that because, it's a combination, that's the best combination, I feel, of mobility and stability. And as we get older, women tend to lose strength, men tend to lose mobility. And the combination of strength and mobility is the definition of power. And that's what we all want to maintain, is power. The power gives the athlete the ability to hit the ball over the fence, but it also gives the elderly person the ability to climb stairs or get out of a chair. That's power. So exercises like yoga combines strength and mobility, and it really gives them a little bit more independence functionally when they get older and allows them to participate in some of the sports that you're talking about.
And clearly, I don't want to make it that people shouldn't be being active. That would be silly. What do you think is a reasonable activity level for people who are 40, 50, above 50? And because I think it all depends on the body type, where you came from. But I think people are wondering, I'm going to sign up for New Year's to join the gym.
Right.
How often should they go? Should they go every day? My son talks to me about the arms one day and his chest one day and his legs one day. He's a wonderful athlete.
Right.
And I'm saying to myself, I'm happy I go there for 30 minutes and go on the treadmill.
Right.
It's also a matter of finding the time. Yeah, most people don't have the time to go every day.
Right.
But I think if you're going a couple of days a week and you're mixing it up, I think aerobic, as you get older, aerobic exercise probably becomes, in certain ways, more important for cardiac function. But some weight training also, I think, is important to maintain muscle strength. So I think you want to mix it up. As you get older, we start seeing more arthritis. So low impact activities tend to be beneficial, whether it be bicycling or swimming, or as opposed to running. So I think that a little bit we're gonna cater the exercise program based upon the age and other underlying medical problems that they have.
So Allan can actually jump in. I'll go totally off topic. So say someone has a knee replacement or a hip replacement. Well, how much exercise should they do?
It should be the right exercise. It should be low impact exercise. A place with a hip or knee replacement shouldn't be out jogging. Most of the exercise should be bicycling. They should be walking, brisk walking, bringing their heart rate up. So golf, I think, is wonderful. They want to say in a competitive sport is a great sport. Bowling. So different sports you can participate in. Playing basketball and football with someone with a knee replacement or hip replacement is not advised.
Does it wear out quicker?
Yes, it does. It's more prone to wear out.
So I think we've run the gamut, from kids, we talked about their muscles, to high school people, to weekend warriors. I want to thank you. You're such a wonderful guest and with such marvelous expertise. And it was very pleasurable. Thank you.
Thank you.
Thank you.